getting there early, using a Raizer Chair and actually getting someone up early will have significant benefits. My name's Ryan Cossington-Webb and I'm the head of the Urgent Community Response Team, or UCRT services, for Mid and South Essex, working across the community collaborative with the 3 community providers: Input, NELFT and Provide.
My name's Claire Palmer and I'm the Clinical Manager for the Urgent Community Response Team in South East Essex and the Single Point of Access.
There wasn't another option out there for patients that are on the floor and needed assisting from the floor. So in terms of the Urgent Community Response Team and the response that we would offer, if there was a patient on the floor, then we would have to call an ambulance and wait for that ambulance to attend to the patient and assist them from the floor with their own equipment.
It could be that you've pressed your care line pendulum and they've gone through to ECAP, and ECAP call us to see if we have staff available to go out with the Raizer Chair, and obviously that patient's triaged to make sure that we're safe to use that device with that person, and then grab the Raizer Chair off of charge and on their way to the patient.
It's had such a significant impact on what we do. I think firstly, number one is the level of care that we deliver and the quality of that care. So actually, if we just look at how we respond to patients that are on the floor now, we're working collaboratively with the ambulance service, so we're receiving calls directly from ambulance control through to the urgent community response team, so they can refer through to us for a patient that's on the floor. That will avoid them having to dispatch an ambulance. We know that during periods of winter pressure and the recent surge in activity that we've seen across the acute hospitals, across the ambulance service, that there are long waits for patients that have fallen and patients that are on the floor and needing that urgent support. So being able to refer through to the urgent community response team, one of our team, our nurses, our occupational therapists, can get out to patients within 2 hours face to face, often much quicker than that, and quickly get them up from the floor with the equipment, with the use of the Raizer Chair.
We're able to respond more quickly than the ambulances because of huge pressure on the ambulances, and they wouldn't be a high priority call, so they could be on the floor for many hours.
We're seeing better outcomes than we would have done previously. It wasn't a service that we had there, that so it's had significant benefits for us as a service in what we're able to deliver, which then obviously has significant benefits on quality of care and care outcomes, care experience of our service users. We're avoiding these patients having what we would class as a long lie. With a long lie, we've got increased likelihood that they do actually need to go into hospital, so we'd be calling that, getting the ambulances out to take them into hospital. We've also got the risk that while they're on the floor, them becoming unwell, the development of pressure ulcers and skin breakdown, which can actually have long-lasting impact. So actually then we're looking at a long-term effect from their fall and just specifically related to the time that they've been on the floor. We know that people that have fallen, that have been on the floor for a long time, that are then being taken up to the hospital, that they often need then more interventions. They're then being admitted onto hospital wards, and we know through that then we've got an increased likelihood of deconditioning and actually them having more complex needs around their discharge and getting people at home, and then needing additional support in the community. So actually just by having a very early intervention and supporting someone from the floor with use of the Raizer Chair, actually there's a wealth of benefits for number one, the patient, but also the system and what we're doing. So actually, if we look at some of the cost effectiveness and financial benefits for us as a health system, they're tremendous by having teams that have a Raizer Chair and can go and use that in an urgent crisis. Probably more out there that we can do, and actually more patients that we can be seeing by just actually promoting the use of the Raizer Chairs and that they are out there. They're with us in the urgent community response teams. We're doing a lot of work at the moment, especially Mid and South Essex, at how we work collaboratively together, how we integrate as organisations. So it's obviously great as the urgent community response team. We have the Raizer Chairs and we're responding to those patients who've fallen. The care homes have the Raizer Chairs at the moment. I think there's more that we could look to do in terms of some of the domiciliary care providers and actually working with them. So ECL are our re-ablement provider as well, across Mid and South Essex, and the care providers. So actually, can we have Raizer Chairs, working with those teams, those services, with those agencies, and actually they could be linking in with services like the urgent community response team. And so I think looking at, wider access to the Raizer Chairs, opportunities for, joint training and collaboration. So actually we should probably move to a place where the use of Raizer Chairs, and supporting our patients that have fallen, our falls pathways in the community is everyone's business across our community services, rather than the reliance on us needing to call ambulance as soon as someone's fallen.